What's going on, guys? Dr. Greg here. Today we're going to launch the first part of a little mini series we're doing on plantar fasciitis. So today we're just going to talk about what is plantar fasciitis and what do we usually feel and how can we know if that's what we're dealing with. So plantar fasciitis has to do with inflammation and little tiny tears within a tissue called plantar fascia. Okay, so that fascia runs from the bottom inside part of your heel bone, and then it runs throughout the arch of your foot towards the balls of your feet or your metatarsal heads, and it has some attachments to some ligaments in that area, okay? So the main function of the plantar fascia is to support that arch and allow you to have stability and absorb load through the foot when you're running, walking, and jumping. A lot of the time, people get irritated in this tissue when they're doing too much of those aforementioned activities, or they're ramping up their activity level too quickly, like when you're returning to a sport or ramping up training for a future event or something like that. So when we do too much training like that, or we do too much standing or walking in general, that tissue can become tight and irritated, and it starts to kind of wear down. The most typical sign that we see with plantar fasciitis is called first step pain. So when you get out of bed in the morning and you take those first few steps, that's when you have the most pain. Or if you've been sitting for a while at work at your desk and you get to move around, that tends to be more stiff and achy as opposed to if you're kind of moving around and warmed up. So if you have pain in the inside bottom of the foot at the beginning of the arch, right on that heel bone, and you have pain specifically in the morning when you're stiff or after a prolonged sitting period, then you probably have some plantar fasciitis. Tune in next time to part 2 of this little mini series where we'll start to talk about what you can do at home to help get rid of that pain.